Hello there, everyone. I'm Gaylen Morse, and welcome to Journey to Recovery. We appreciate having you along today. On today's program, we'll talk with Dr. Hal Baumchen about what makes treatment helpful and effective. Thanks for joining us today. Our podcast provides a solid, truly integrated co-occurring disorder resource you can use in your treatment program or in your own recovery. Our host is Dr. Hal Baumchen, a licensed clinical psychologist and licensed alcohol and drug counselor. He's the executive director of Northland Counseling Services and the clinical director of North Star Regional Co-occurring Disorder Treatment Programs. He's an author, speaker, and clinician with over 30 years of counseling experience. I'm here along with Tim Bode and our host, Dr. Hal Baumchen. How are you guys doing today?
Doing great, Gaylen. How are you?
Good,
Gaylen,
thank you.
Thanks for being here. Thanks for allowing us to come into your studio. It's always nice to be here. And today we're going to talk about treatment. And we go ahead.
And philosophy of treatment, right?
Right. Yeah. Why we do what we do.
Right.
And
So speaking of philosophy,
Tell me.
How many philosophers does it take to change a light bulb? Well, that depends on how you define change.
yes, nice. Yeah.
So anyway, we are going to talk about philosophy.
Great.
And answer some questions like what makes treatment successful? What makes recovery work?
At Journey to Recovery, we try to write materials that are effective, that are something that's going to be helpful. So here, a man or a woman comes into treatment and they're looking for some help. And can we give them something that's going to work and that they can learn, remember, take with them, process, make it easy for them? So we're going to try to talk through what works and what doesn't work. I think what we used to do years ago, Tim, is kind of yell at people and tell them to quit using or quit drinking like that. That old stop that therapy, don't do that anymore, stop that. But that was, of course, not effective. But there are some things that we do in co-occurring disorder treatment that are, in fact, helpful. And the resources on our website probably carry this through as well. So we're going to ask our listeners to check that out from time to time.
Right. So resources that identify and treat substance use and mental health, right, together, those are going to be the best resources.
Right. At the same time, in the same place, you know how we talk about that with the same treatment staff. But boy, if you could get a resource that dealt with substance abuse, which of course you want to do when you're coming into chemical dependency treatment, and also find something that worked with the mental health issues, say anxiety, depression, bipolar illness, if you could get both of those working at the same time, with the same counselor, the same materials, that would really be powerful.
Right, and that is truly integrated co-occurring disorder treatment.
Both go on at the same time. We've talked, Tim, you know, how some programs are, you know, one thing at a time or maybe parallel at the best. But boy, if you could integrate them, that's even better. So when I write, I'm trying to incorporate the difficulties of substance abuse along with the problems in mental health, and then find solutions for both of those at the same time.
Right. So how do you do that in a treatment program?
The materials that we've developed on our website, they're available on our website, but we use them in a couple of manuals in the treatment centers as well. And those treatment materials, you know, just process what's it like, why are you using the way you're using, are there any mental health issues behind that kind of thing.
Seems to be a lot of topics. How do you kind of keep everything straight?
Right. Yeah. Well, I'm proud of having a lot of topics. So if you have ADHD or bipolar or depression, or you're stressed out or burned out, or you have family trouble or relationship problems, we've got topics that we cover in the treatment plan, in the treatment programming, and also resources available on the website that are going to help with all those different topics. So it's nice to have, you know, a whole library of resources to draw from.
Mm-hmm. Dr. Hal, can you talk a little bit about the purpose of co-occurring treatment?
Treatment for co-occurring disorders is designed for two primary reasons. One is to reduce symptoms, and then secondly, to reduce or prevent relapse.
And then we've talked about having a lot of topics that are covered. What are some of those topics?
Some of the topics present information on certain emotional disorders like anxiety and depression and bipolar illness, like I mentioned earlier. And then also things like eliminating bitterness or being able to forgive somebody and eliminating exceptions and excuses. Some of my favorite stuff to talk about is I think I'm filled with exceptions and excuses. I was going to pick you up on time, but then, something came up. You know how that goes.
Yeah.
Even establishing boundaries is another one. I'm going to do a seminar here in a week or two on establishing boundaries and that issue of codependency, where even though you have a substance use disorder, you still might be in a codependent relationship with somebody else who's also addicted to something. But you enable them, they enable you. Mm-hmm. So we're going to talk about that in a couple of weeks.
Mm-hmm.
Seems like this would require a pretty fair amount of education and a pretty good set of skills.
Right. So we try to help somebody get the education that they need in terms of learning about that topic. But also, can you develop a skill so that you can apply that? So you know how this goes. It's not just what you learn, but you have to apply it over time. Otherwise, you're going to forget it. And they tell me that if you don't review it within 24 hours, it probably slips away pretty fast. I remember when I went to graduate school, I did a doctorate program, and they told me that half of all that I learned would be obsolete within 10 years, and that I would forget half of all that I learned. But I'm sure that I forgot the half that was actually relevant, and I remembered the obsolete part. Yeah.
So who are these materials helpful for?
The Journeys materials, both in the manuals, stuff on the website, the stuff we use in the treatment center, are designed for people in recovery or people who work with people in recovery.
So the information is basically applicable to both the counselor and the client.
Right. And I like thinking that it's information for the client that a counselor would like using. So the counselor can go to the website, print something off, and then use it in the treatment center. I'll give a little shout out to Bobby Frost, who works for us in one of the treatment centers, and he uses the material that, it helps him, of course, but mostly he's printing it off and handing it out to clients or playing a podcast or something. So, Hey, everybody, thanks for tuning in today.
So, Dr. Hal, how are these materials helpful?
Well, one of the big things is you got to change up your life. So you can't just, like we were laughing about earlier, you can't just quit drinking. You really need some lifestyle changes, make some better choices in terms of how you manage your life, how you manage relationships, how you manage your recovery program. But some of these habits and routines, they've got to be changed sort of from the foundation on up.
So you're talking lifestyle changes, not just, I'm going to quit drinking.
Right. And working with those evidence-based practices that we talk about, like CBT, those are going to help you make those lifestyle changes, change the way you think, not just change the way you drink.
Yeah, and that's not an easy thing, is it? Personal growth and change is difficult.
Right. And my personal growth, probably for most people, personal growth doesn't come for me when all my bills are paid and everybody's happy with me and the dog's well fed and everything's going right. Personal growth usually comes when, things are going wrong and the car doesn't start and there's a huge snowstorm in Minnesota and you can't, the clinic's closed and somebody's mad at you and you're disappointed somebody once again. Then the strides you make, that actually matters. So now I can get some personal growth to occur. Yeah. So go ahead, Gaylen.
Well, I was going to say that seems to be basically what we're trying to achieve here.
Yeah, so just some character transformation in addition to some behavior changes. We're not just trying to help people with one or two things. We're trying to help you be a different person.
Right.
The more time you invest in understanding your recovery, the better the outcome you're going to have. So you understand your recovery, but you're also trying to understand why you do what you do, why you're this way, how you could be different. Hey, I'm an angry person. That's just the way I am. Well, get that fixed, man. Get that looked at.
Yeah. So today we're going to look at some of the foundational elements in the Journey to Recovery philosophy.
Yeah, I got a feeling that we probably stumbled across a few of them here already, just talking through a couple things.
Right. So the first one we're going to talk about is that treatment is a choice.
Makes sense, doesn't it? So that somebody is going to get more out of it if you choose to or decide to go to treatment. And treatment is a choice.
You know, some clients do get referred, and I'm sure they feel like they have very little choice.
Right. They get an ultimatum from a spouse who said, get into treatment or I'll leave you. Don't you think I won't? Or a probation officer who demands treatment, a judge who refers to treatment saying part of what you need to do is go to treatment. So that woman, that man come to treatment sort of against their will, don't they? They feel forced to come, but in our philosophy of treatment, we want to remind everybody that even when you kind of get pushed into the front door, the moment you step across the threshold, it's kind of a choice to stay there, especially in our treatment programs where the doors are, in fact, not locked. Well, if I leave, I'll have to go to jail. Yes, I understand that, which would sort of be a bad choice, but truly you have a choice. Yeah.
So what about court referrals?
Even when the door isn't locked, you could leave on day 2, but people have a choice. And so I like it if they choose to stay. Hey, if I sort of have to be here, I'm going to choose to, decide to, will to, and want to stay.
No one likes to feel forced into treatment, do they?
Right. Whenever I feel forced, whenever people feel forced, I think it raises an automatic resistance. Like, you make me, forget you. You can't make me do anything. And that attitude, maybe that doesn't come out, but that's underneath. Mm-hmm. And so when people feel forced, they automatically resist.
So basically, you want people to choose to get as much out of it as you possibly can.
That's one of my key words: choose to, decide to, will to. Yeah. So get your will around it as quick as you can. Well, I have to be here. No, why don't you choose to be here? And if you have to stay, why don't you choose to stay?
Even if you are forced to go, even if you're court ordered and you have to go.
Right. Get your head around that. Like, well, I've got choices here.
The second part of our philosophy of care is that we believe that treatment must be individualized.
Somebody who's coming in with substance abuse like methamphetamine, and they're also depressed or something, or have ADHD, amazingly, they're using methamphetamine, and we want to treat both parts of that. So it's got to be individualized. We got to treat that person as an individual. What are you struggling with? How can we help you? What do you need now? Been in treatment before. How did that help? How didn't that help? What can we do for you now?
So each person is treated as a totally unique individual then?
Right. All in the same group where everybody has to participate in that group and go over the same material. Like, what? I thought you said it was individualized. Yeah, so even though there's some structure to it, we still want to make sure it's targeting your concerns individually.
Right, so each person in the group has their own individualized treatment plan, right?
Right, so we set it up so that they're getting what they need when they need it, and before they move on to the next phase of treatment, they've been helped at that level where they started, sure.
Now, the Journey's curriculum is cognitive behavioral therapy oriented, correct?
Give a guess on what that means. We've talked about this. You work for us.
In order to change your behavior, you have to change the way you think.
Right. Yeah, that's great. Changing the way you think and what you believe is going to help you change the way you feel and the way you behave.
Explain that again. How about an example?
Okay, thanks. Yeah. So you've maybe heard me say this before, but if I think and believe that there's a ferocious dog on the other side of the door who's big and black, not little and fluffy and white, but big and black, and I believe on the other side of that door, I open the door, the dog's going to bite me. So now, because I think and believe that, I have corresponding feelings, maybe anxiety or apprehension or irritability or fear that goes along with my thought and belief that there's a dog that's going to bite me. So now I have these thoughts and strong feelings. Then I'm going to have a corresponding reaction. I'm not going to leave the room. or I'm going to ask you to deal with the dog. So now my actions and my strong feelings perfectly fit my thought and belief, my belief that the dog's going to bite me. Now, it turns out there is no dog on the other side of the door. So my strong feelings of fear and my behavior, not leaving the room, perfectly fit what's not true. Now, perfectly fit your thought and belief, and your thought and belief is inaccurate or a misperception. That's so common in substance abuse, anxiety, depression, all the emotional disorders. We have strong feelings and resulting actions that are based on something that's not true. Mm-hmm. That's cognitive behavioral therapy in a nutshell. So the therapy part is change the way you think or believe in order to change the way you feel and the way you act. So if you're drinking too much, maybe you have to change the way you think. Oh, what do you mean? Well, I'm drinking because the only way I know to calm down is to have a drink. Well, we want to change the way you drink, but we want to change that thought and belief behind the way you drink as well.
So, Dr. Hal, talk a little bit about how the resources available through Journey to Recovery play into that.
That's good. The Journey to Recovery and the books that we've written are kind of basically cognitive behavioral therapy. So in so many of the lessons, we're trying to help people change the way they think. Or can you think about it differently? Or can you recognize that negative thought or recognize a misperception, a distortion in your thinking?
Another one of those foundational elements is that making lifestyle changes prevents relapse.
Right. We're trying to talk through some basic philosophy. What do I think about trying to treat people that's going to help them sustain a long-term recovery? And one of the things that's helpful, like you mentioned, is changing up your life, making some long-term lifestyle changes, and that's going to prevent relapse. Again, if you always act the way you've always acted, you get a little treatment, but you go right back to the same friends and doing the same thing, you're going to end up in big trouble. Got to make some lifestyle changes.
Yeah, in order to prevent relapse, the client has to be both committed and motivated.
Committed to do what they need to do right now, and then motivated to sustain that long term. So that's correct. Commitment and motivation are a big thing for me. If you start with a lot of motivation, but then that dumbs down, like how little can I do and still get by, that's going to cause trouble. So got to keep that level of motivation high.
Like many things, recovery isn't usually a straightforward one treatment fits all for all time, is it?
No, they're going to have to, somebody coming into treatment, yep, they've got to take that seriously, and then they'll have to sustain that. And so you got to keep practicing whatever worked for you to get your recovery. You might have to keep practicing that to sustain your recovery long term.
So maybe there's another failed relationship, another lost job, another DUI, another brief stay in jail.
And all of those failures, mistakes, and all of those consequences that come from those mistakes become the chief motivation for seeking help. And those past mistakes actually color the present moment. But again, we don't want to just live in guilt or shame or remorse. We want to use that like, I'm going to change up my life so that doesn't happen to me again.
So in your experience, Dr. Hal, are people motivated when they come in for treatment after a failure like that, or are they discouraged?
Both. I think they're discouraged about the past. Many people, surprisingly, Tim, are encouraged, like, I get to try again. And I could have died back there. I'm glad I didn't. Tried to kill myself. I'm so glad that didn't work. Or I took drugs so carelessly that I could have died. But I want to change up my life. And they use that to get better, and then hopefully they'll use that to sustain that motivation and stay in long-term recovery.
Of course, our materials at Journey to Recovery are designed to develop that hope.
Yeah, I'm proud of that. I want it to be encouraging, upbeat, positive, and hopeful.
Today, we discuss several important tenets of our philosophy of care, including that treatment is a choice, treatment must be individualized and meet specific needs, and that relapse can be prevented by making lifelong lifestyle changes.
I believe, Tim, that everybody deserves another chance. I don't even like the term second chances. I like the term another chance because most people have blown through to the second chance long ago. But let's grab hold, take another chance at recovery. And so we want to encourage our listeners, we want to encourage people, get in recovery, stay in recovery, do the work necessary, find your level of motivation that you're going to be able to use to change your life and stay in long-term recovery.
Well, thanks for listening to today's podcast. You can download materials that help you develop skills to identify emotional problems, reduce symptoms, and prevent relapse at journeytorecovery.com. We've been visiting with Dr. Hal Baumchen, a licensed clinical psychologist and licensed alcohol and drug counselor. His expertise and clinical wisdom is now available through books, blog articles, podcasts, and treatment materials at journeytorecovery.com. Share this resource with your peers and colleagues. See you next time, and remember, recovery is a journey. Enjoy the ride.